My name's Amy, and I am with the eligibility determination team with Mercy Hospital. Um, my, I'm going to be a little bit different. I appreciate Ann and Jen's speech, our talking points. It's nice to know the changes that are coming, but I'm more here to just kind of update you on Medicaid and Mercy's ability to help you, because we're just there to help people get through the current Medicaid world, and we'd be there to help you through the updates of what's going on. Our history at Mercy, my team's history, is we started in December after bringing our services back in the house. We had a team of 4 start, and then in April 25, we've started expanding and began consulting emergency room departments. So we've got people there kind of ready to help everybody, whatever part of Mercy you're at. And so what we want to do is help patients maximize the insurance coverage for which they are eligible. So what we do on a daily basis, identify and consult self-pay patients to see if they're eligible for Medicaid, consult with patients with only one insurance for secondary insurance coverage through Medicaid, and we also refer for Mercy Financial Assistance, which is Mercy's own program where they help with patients that are eligible for extra savings. We consult with patients for Medicare savings programs. We help older patients enroll for elderly waiver and facility Medicaid, and we are there to help with the follow-up, which is the toughest part of Medicaid sometimes, with the Department of Health and Human Services to ensure all required documentation is submitted in a timely manner, which is a big part that a lot of people, where they fall through with getting approved, is that because they don't make it easy, it's a lot of paperwork and stuff that they want. So if we can help get that follow-up through, a lot more people are successful. So I'm just going to kind of go through the different types of Iowa Medicaid as they stand right now, just so everyone has a basic understanding of what they may be eligible for. Iowa Medicaid, as it was mentioned, is a joint federal and state government program that pays for medical care for some low-income and medically needy individuals and families. There are different Medicaid programs depending on age, resources, and need. There's Medicaid, Iowa Health and Wellness Plan, which she was talking about Medicaid expansion. That is Iowa's Iowa Health and Wellness Plan. You may hear it referred to as IHOP. Healthy and Well Kids in Iowa, which is Hawkeye, which is the higher income limit for the kids. And then there's other plans and programs. Medicaid in general is available to those age 65 or older, blind and have a disability, families with dependent children, pregnant women, and children up to age 21, children formerly in foster care up to age 26, adults ages 19 to 64, and there's special programs for women with breast or individuals with breast and or cervical cancer or precancerous conditions. Eligibility is based on financial and non-financial criteria, such as income, assets, citizenship, Iowa residency, immigration status, and disability when used as a basis for eligibility. So I'm just going to go into some details with some of those separate programs. Iowa Health and Wellness Plan is available to individuals aged 19 to 64. Same eligibility, non-financial requirements as Medicaid. You have to have income below 133% of the federal poverty level. You can't be eligible for Medicaid under the mandatory coverage groups, and you are not eligible if you're entitled to or enrolled in Medicare. So there are no charges for health services during a member's first year of enrollment. Beginning in the member's second year of enrollment, there could be a small monthly contribution required. Then we have Hawkeye, which we talked about. It's available for children under 19 years of age. It's a higher income limit. If you're below the 302% federal poverty level for both Hawkeye and Hawkeye Dental only, and premiums are based on family income. One thing about Hawkeye is you can't have any other insurance. So you can't have Hawkeye if your child has health coverage from your work insurance. So that, because regular Medicaid you can, but Hawkeye you can't. Cannot be a secondary insurance. There is the Medicare Savings Program. And what the Medicare Savings Program does is it will help pay that Medicare premium that's coming out of your check every month. I think right now it's $185 a month that you get back if you're eligible for that program. It's not real high income limits. It has 4 different types, which makes it more confusing. But one of the types does help cover medical costs, including premiums, copays, and deductibles. Elderly waiver Medicaid is a Medicaid waiver to help the elderly population stay at home. If you have a family member or friend that wants to stay home and doesn't want to go to the facility yet, that this is a program for them. It includes assistive devices, home health aid services, homemaker assistance, home delivered meals. Those are just some of the options available. And here at Mercy, we are proactively identifying elderly patients who qualify because too many people get past the point of being eligible, and there is a waiting. It takes a little bit to get, so we don't want people to be to the point of having to go to the facility because they didn't get that help. If you need that help in the home, where you get your medication and otherwise people are home and they shouldn't be and they can fall and things are happening, where if they can stay home and have care, a lot of times it keeps them at home longer. So like it says, getting services in place before the patient and family find themselves in a crisis situation. Then there is facility Medicaid. Nursing facilities provide 24-hour care for individuals who need nursing or skilled nursing care. Medicaid can help with the cost of care in those nursing facilities, but you must be medically and financially eligible for care in a nursing facility, and Medicaid may pay up to the full cost depending on your resources and income. So just in closing, Mercy's mission is to care for the sick, enhance the health of the communities we serve, guided by the spirit of the Sisters of Mercy. My team is there to help. That's the whole point of what we want to do. We want to make sure that everybody is getting the care that they need. And this is another way that we can fulfill our mission.